Tonight we have a very special program. It's a two-part program. So we will start the program with a session about the coronavirus, because this is the fad, this is the thing that's going on right now. For those of you that have been to the stores recently know that people are going into an all-out panic mode. So we thought it's important to have an informational session from experts to actually understand what we're dealing with and what we should be doing as a community. I was mentioning that my wife yesterday, we actually are running out of toilet paper at home. Not we were trying to stock up, we're actually running out. So my wife went to Costco yesterday and she saw people coming out with piles, like mountains of toilet paper, and she couldn't find any at Costco or water. So the question is, what should we be preparing for? What should we be doing? We have two experts with us today. We will start with Dr. Usama Qandil. Dr. Usama Qandil has a PhD in immunology from Tufts University. He was also a lecturer at Harvard University, and actually when I worked with him many years ago, he did an interview with Anthony Fauci, who happens to be one of the lead people working on the issue of coronavirus for the federal government. So we'll start with Dr. Usama Qandil. He'll give us a presentation for about 15 minutes, and then we will move on to Dr. Benjamin Schwartz. Dr. Schwartz is an epidemiologist with the Fairfax County Health Department. The next step is we're going to have a presentation on the harm reduction program of the health department that's being implemented in the Colmore area, and then we will open for question and answer at the end, inshallah. I know there are many questions and answers. So without further ado, thank you for attending. Thank you for our guests for being with us tonight. Dr. Usama, the floor is yours. You can use this mic.
Assalamu alaikum, everyone. Thank you, Saif, and thank you for Dar Al-Hijrah for allowing me the opportunity to talk a little bit about the coronavirus. I will mention a few important topics, and then I will leave Dr. Schwartz to talk about the epidemiology. I hope I don't overlap with some of what I am going to say with what he was planning to say. So the current coronavirus is a new coronavirus. The known coronaviruses to date are 7. 4 of them are present year after year. So 4 of them do not cause the outbreaks that we have seen with the novel coronavirus that I'll talk about today. And the remaining 3, the first one is called SARS. The second is MERS, Middle East Respiratory Syndrome, that happened in Saudi Arabia a few years ago. And the third one is the novel one, which we are talking about today. So the outbreak that we are experiencing and the world is experiencing now is called COVID. And this is the abbreviation that the WHO, the World Health Organization, designated COVID, which means coronavirus disease 19, because it was first recognized at the last day of 2019, on December 31st. It's an infectious disease that causes respiratory illness. And it's caused by a new coronavirus, as I've just said. The new coronavirus was named the Severe Acute Respiratory Syndrome, which SARS stands for, coronavirus number 2. Like all viruses, they cannot reproduce until or unless they enter into a host cell so that they can replicate using the host cell's reproductive machinery. So that's an important trick that I'm sure we will address later in the talk, because we will find ways to stop that reproductive cycle. The source of this new outbreak was in a fish and animal market in the capital of Hubei province in China, Wuhan. And it is thought that the mixing of animals and the viruses that reside in many animals, especially bats, somehow found its way to humans. And this process is called zoonosis. So it skipped from just being an animal virus to starting to infect humans. And then it started transmitting between humans, from human to human. So this was declared a public health emergency by the WHO. It stopped describing it. It didn't call it a pandemic because it's not its role to call it a pandemic, but it is a pandemic because a pandemic is an infectious outbreak that spreads beyond the borders of a particular country. And as you all know, it is now present in 90 countries. And the total number of cases as of yesterday morning exceeded 100,000, with 3,400 deaths worldwide, 80% of which is in China. You've heard also that South Korea has the second highest infections, followed by Iran, then Italy now, and then many other countries. In the US, there are 233 confirmed cases from 15 states as of yesterday morning, with 14 deaths, 13 of which were in the state of Washington. One thing I'd like to mention here, that this virus is now spreading in what is defined as community transmission. Community transmission means people who were infected by unknown means, who had not come in contact with known patients and had not traveled to countries hit by the outbreak. And that's the seriousness of this outbreak, and that's why we are having this talk, so that everyone is aware of what he or she can do to prevent infection. The coronavirus is a highly antigenic virus, and I'd like to clarify this because it's important from an immune system point of view. Some viruses can mask what's on their surface to elude the immune system. However, this coronavirus has 4 prominent protein spikes on its membrane, and that's why it's called a corona, because it looks like a crown on the outside of the virus. But having that particular property stimulates the immune system to find it quickly and mount a very strong reaction if the person who is infected has a strong immune system. And I'm going to elaborate on that later. The symptoms, I'm sure everyone have heard about the major symptoms. Fever is present in 88% of those infected. This is followed by cough in 68%, and then fatigue to a smaller extent. 38% of those infected exhibit those symptoms. Infection, I'm sure most of us know how this virus is infecting people. It's doing that through water droplets that result from coughing or sneezing from an infected person to the people or the group that's surrounding that person. Diagnosis of this virus is very simple and is widespread. The Chinese scientists who isolated the virus earlier in this year published the genome of the virus to allow labs all over the world to develop techniques to test for the virus. The most common one is the polymerase chain reaction, PCR. There are antibody tests as well, and these usually take between a few hours to a couple of days for the results to be known. There are other methods to diagnose, and the Chinese are using CT scans widely, and in a study that was published last month by Chinese scientists, they found that chest CT scans have a 98% sensitivity in diagnosing the disease, COVID-19. Prevention, I'm sure Dr. Schwartz is going to talk about it, so maybe I would skip it now. I'm just skipping the part that talks about prevention. As far as vaccines and medical treatments, currently there are no vaccines. However, there are so many organizations, companies, and national labs that are working to develop a vaccine. Dr. Anthony Fauci, the director of the National Institutes of Allergy and Infectious Diseases, has mentioned in a recent interview that it will take between 12 to 18 months to develop an effective vaccine, some of which have already started some preliminary trials. There are many universities worldwide and companies too that are working on this vaccine. As far as treatment, currently there is no drug that has been approved to treat the coronavirus infections in humans. However, companies and labs are looking into existing antivirals to see if some of these will be effective against the coronavirus, the novel coronavirus. This is some of the molecules that are thought to be effective are known antivirals. However, the WHO is warning against using corticosteroids because that will cause the inhibition of the immune system, which you don't want to see in a patient who has an infectious disease. So some of these drugs or these antivirals, one of them is called remdesivir, lopinavir, ritonavir. One is very well known, chloroquine, and preliminary data show that some of these may be effective. So currently they are not indicated for the coronavirus that we are seeing now, but they may potentially have a very useful role in combating it. I'm going to defer talking about prognosis because I think Dr. Schwartz might be covering that too. If not, then we can handle these in the questions and answers. So finally, when we talk about how can we protect ourselves from this virus as far as our immune system is concerned, I'm sure most of us know that the immune system is the white blood cells that we have in our circulation that scour the body looking for harmful substances, looking for cancer cells, so that they can attack and rid the body from these harmful things. So there are several ways where each one of us can enhance or help enhance their immune system. One important thing that everyone can do is to have a good night's sleep. Having a good night's sleep is very important in recharging one's immune system and helping our immune cells invigorate and become powerful. That's number one. Number two, living a healthy lifestyle. And there are several things to be said here. A healthy lifestyle means that we should eat healthy food. We should drink sufficient water daily, because having plenty of water allows the blood to be flowing faster and the immune cells to go and detect viruses, bacteria, cancer cells, and other harmful substances. We should also especially focus on vitamin C rich food, oranges, strawberries, lemon, lime. All of these are very useful to strengthen the immune system. Another factor to live a healthy life is to avoid things that destroy the immune system and destroy the body. Some bad habits that contribute to that include smoking, because smoking introduces harmful substances to the lungs and the body of the smoker, and it also compromises the lung, making it more susceptible to this particular coronavirus because it's a respiratory virus that goes to the lung, and people who die usually die because of underlying compromising of the lung. So avoiding pollution in general, avoiding smoking, avoiding noise pollution because that causes stress, and stress hampers the immune system. And this is the third part, which is stress control. We should try to make ourselves as much as possible stress-free by following certain things, by not worrying much about materialistic things, about becoming more spiritual, focusing on the sufficient gifts that Allah subhanahu wa ta'ala has bestowed upon us, thanking Him for that, and becoming content with what He has given us. That plays an important role in making us satisfied and content, and reduces the stress levels, which eventually, if there is stress in the body, especially if it's psychosocial stress, it leads to the compromise of the immune system. And I can talk a lot about that if there is a specific question later. These are some of the things that we should really pay attention to enhance our immunity, because the immune system is not just the most effective way to get rid of any type of infection, but it also helps us and protects us from cancers and other harmful things. So with this, I would stop, and I would give the microphone to Dr. Schwartz.
Assalamu alaikum. So I'm sure that the two questions that many people are wondering about, the first question you may have is, how worried should we be today about coronavirus here in Fairfax County? And perhaps the second question is, what should we think about in terms of the future? Is this going to get worse? How long is it going to last? What can we expect to happen? So let me address that first question, and then later on the second question about what the future might hold. Currently, in Fairfax County, as of this time, we have zero. We do not have any cases of coronavirus infection, of COVID-19. There are several cases that were identified in Maryland, in Montgomery County, and one case in Washington, D.C. So that there are cases nearby, but not in our county as of this time. So the risk in the general population, the risk in the community, the risk in your day-to-day activities is still considered to be low. There is higher risk in communities that do have the community spread of the virus, like in Seattle or perhaps in Los Angeles. There also is higher risk among people who travel to countries where the virus is present, and also among people who are contacts of coronavirus disease cases, but not for the general population at this time. But that doesn't mean that we can be confident that it's not going to become a problem. So even now, while the risk is low, we need to begin doing things that can prepare for it and begin adopting the good habits that will allow us to be healthy when the virus does get here. And I'll talk about those also. But let me first talk about how coronavirus spreads, because if we understand how it spreads, then that helps us better understand what we can do to prevent that spread. So coronavirus is spread by secretion. So when someone coughs or when someone sneezes, the particles that come out of their mouth or their nose travel about maybe 6 feet. And so if somebody is close, if you're close to somebody else, they may get the infection. They may breathe in some of those particles, it gets into their throat, it gets into their lungs, and can cause infection. So generally, for someone to get infected, you have to be closer to them than 6 feet for perhaps 10 or so minutes. You can also get infected by kissing, by sharing food, by sharing drinks, by sharing utensils. So understanding that then helps you realize some of the things you can do to stop infection from occurring. The symptoms of coronavirus infection are fever, cough, and shortness of breath. 85%, almost 9 out of every 10 who get the coronavirus infection will have mild disease. They won't need to go to the hospital. But about 15%, maybe 1 in every 7 people who gets this disease, will get pneumonia or severe infection and require hospitalization, and about 2% will die. The people who are at greatest risk of dying from coronavirus are people who are elderly, people who have underlying diseases, lung disease, and people who have suppressed immunity. For example, people who have cancer. Also, pregnant women may be at increased risk of this severe coronavirus disease. So what is the approach that we're taking in our community and in communities all across the country to stop the spread of this disease? So the first approach we're taking is something that is called containment. And what containment means is we want to keep it from spreading into communities where it doesn't already occur. And the way that's done is by quarantine of travelers, so people who are coming from countries like China, like Iran, like South Korea or Italy, are being told to stay home for 14 days and not mix with other people in the community. We also are investigating every single case that is identified and keeping those people isolated away from others and finding out who they've been in contact with and having those people also stay home. So by separating people who have the infection from everybody else, we hope that we can contain it. And then the other current approach, the other current approach is encouraging personal protective behaviors, and you've already heard about some of those. So it includes hand washing, covering your coughs, staying home when you're sick, and this is really important. So if people are sick, they should stay home so they don't make other people sick. And not touching your face, your mouth, your nose, your eyes, where you can spread the infection. So if you touch a surface that has the virus on it and then rub your eyes, you may get the virus in your eye, and then it will go into your lungs and can cause the disease. So these are things that everybody should be doing now in order to stay well. But what do we do once disease comes to our community? Once we have cases spreading in Fairfax County, what else can we do to keep from getting sick? And so first, it's important to continue to practice those good behaviors, to wash hands, to cover your cough, to use your sleeve, not your hand when you cough, to stay home when you're sick. But there are other strategies we need to do as well. And one strategy is what we call social distancing. And what it means is staying 6 feet away from other people, not coming in close contact with them, so that we may social distance if we can telework. If we go shopping, instead of going shopping when the stores are crowded, go during the hours when not many people are there. At work, instead of having meetings, have conference calls if you can. Gatherings may be canceled, concerts, sporting events, other places where people congregate. Schools might be closed. And this might occur closing all the schools at once, or more likely closing schools where there has been a case of coronavirus disease in either a staff member or in one of the students. And then for communal practices, consider how to socially distance. Consider what you can do in your daily life, in your religious life, in your communal life, to keep that distance and to adopt good habits that will stop the spread of infection. Now, a lot of people wonder, should I be wearing a face mask? Will wearing a face mask protect me from getting sick? And actually, the people who should be wearing face masks are those who are sick, so that when they cough or they sneeze, all of those secretions are caught in the face mask and don't spread out and affect those who are around them. But for a person who is healthy, wearing a face mask has very little impact. And so it is not recommended that people who are not sick wear face masks. So if you have symptoms of respiratory infection, first, most likely those symptoms are not COVID-19. They're not this new disease. We know that influenza every year in the United States causes millions of infections. And so the first thing to do if you have a runny nose, if you have a cough, if you have a sore throat, don't immediately assume that it's this new disease. But at the same time, it's good to stay home and to stay away from others, to cover your coughs and sneezes and all those good practices that will keep you from spreading any disease, whether it's influenza or COVID-19. If you do develop more serious illness, call your doctor or call the emergency department. But instead of just going in, tell them first what your symptoms are, and they may tell you what protective things you can do when you come in so that you don't infect others. And then I think it's very important that we also think not just about ourselves, but we think about our community and what we can do to support other people and the people who are most at risk or the people who are disadvantaged, who live in more crowded settings, who take crowded public transportation, who don't have sources of medical care, and who are more likely to become sick, and if they become sick, are more likely to become more severely ill. And so we all have to think of both ourselves and what we can do, but we also should be thinking about our neighbors and what we can do for others. And so with that, I think I'll stop. And should we do questions about coronavirus first? Or?
I think we wanted to do the questions at the end, but what I will say before we go to the next part of the program is as the masjid, we're putting out information to the community that if you are feeling sick, that there is no reason to come to the masjid, particularly with influenza symptoms, which the doctors have mentioned. You can stay home and don't come to the masjid if you're coughing and sneezing and feeling like you're sick. Before we go to the next program, I want just to everyone be aware, we're going to talk about a program which the Fairfax County Health Department is working on in the Colmore area, which is this area. And this program has to do with working with people who are have substance abuse issues. And it's a program that the county is working on. After this presentation, we'll open up for question and answer before Isha prayer, inshallah. Go ahead.
Thank you. Assalamu alaikum. I am Dr. Nahira. I am an epidemiologist with the Fairfax County Health Department. I study diseases. And like we've been talking about coronavirus, which is an epidemic, it's a disease that is out of control. We have another epidemic in the county and in the state and in the country. We call it the opiate epidemic, where people are using and abusing opiate drugs. These opiate drugs are derivatives of the poppy seed, the opiate drug that is found in heroin and in some pain medications. For many different reasons, people start using these drugs to control their pain, and they become dependent on them, and then they become addicted to them. And so it interferes in their lives because they need to go out and get these medications, these drugs, and they are getting into trouble for being on this addiction, right? One of them is very strong, called heroin, and it's an injectable drug, so somebody puts it into a syringe and injects it into their veins, and that's how they get the effects of the drug, and they become addicted to it. Other drugs are found in pills, and they also take them in excess. And when you take these drugs in excess, and you take too many, one of the effects is that you are unable to breathe. You pass out, you go to sleep, and you cannot wake up, and that is called an overdose. And when somebody overdoses, it is necessary to get them to the hospital and to get them care. Another thing that happens with opiate drugs, especially the injectable ones, is that people share the needles with each other. And when they share needles, they may transmit diseases like hepatitis, HIV, and other infectious diseases through the needles. And so that becomes a problem because then they may go out into the community and infect others in different ways, not just through the needles, and infect people and get them sick. So one of the things that we are working on at the county and here in the Seven Corners area is to establish a program called a comprehensive harm reduction. Comprehensive means that it is going to have many different components, many different aspects to it, many different ways of trying to help people who are addicted to these drugs. And one of them is to, when somebody comes in and they're using injectable drugs, they give the program their use needles, and they are given clean needles to use. When they have this exchange of needles, they are also offered help. So we will offer them help to become not dependent on the drugs anymore. We will offer them food, shelter, anything that they need in order to get on the road to recovery, to not be addicted anymore. So while the main component of this program is a needle exchange, it is comprehensive because it will also have mental health help for the person so they can deal with whatever is causing them to become addicted. It'll offer them shelter, like I said, food, transportation to the doctor, medical testing, so to make sure that they're not infected, and if they are infected, then they are given medical care and other services. So this program is going to be located in the Seven Corners area through a organization called Nova Salud. They will be the ones that will be handling it. It's going to start small with 1 or 2 people who will be allowed to come in and use these services. But then as they go out into the community and refer other people who are using drugs, it'll expand. In the last 5 or 6 years, the community, there have been more people dying from overdoses than from car accidents. And that is very unfortunate because they're very preventable. The car accidents, they're accidents, they happen. But the overdoses, they can be prevented by teaching people about addiction and staying away from addiction. And if they are addicted, to help them get on the path to recovery. And this program is one of the things that we are planning to use. Another thing that the program will do is it will give people a drug called naloxone. It's a drug that is injected into the nose. So if somebody is overdosing, anybody can just take this drug and put it up their nose and help them stay alive until medical care can come and help them. And that has been shown to prevent a lot of deaths and give people a second, third, or fourth chance to go and get help. So we wanted to tell you about this program because you are the people that will be living here and will be hearing about it. We want to get your thoughts about it, any questions you may have. If you have your own thoughts or your own criticism about the program, we want to hear that. And we want to help you understand the program better so that when it begins, it is not a mystery. It is something that we all understand and we all can collaborate on. Thank you.
Thank you very much. I want to open the floor to question and answers. And I know a lot of people are going to ask about coronavirus. So before you do, I'm going to ask a question that was asked of me on the last point, just so that people understand. When we started talking about this program and started to have some internal discussions, the first question is, you know, you're basically gonna help drug dealers or people who are taking drugs take more drugs. So how would you answer that question when that comes up? Because you know, it's very clear, for example, that our vice president, you know, when he was the governor of Indiana, he refused to allow this program because he felt it would further allow people to use drugs. So what's the answer to the statement that, you know, this will only help people use drugs more?
So when Vice President Pence was Governor Pence of Indiana, he did not allow a similar program to take place in his state. And the result of that was an outbreak, an epidemic of HIV. For the most part, HIV in that part of the state had been under control. There was no more new cases. But because people started sharing the needles with each other because they did not have access to clean needles, there was this epidemic of HIV, and there were some cases of hepatitis as well. Had the program been in place, we would have prevented those infections, and the infections then pose a threat to the rest of the community. The people who come in to get clean needles, they will not be given drugs. They have to get the drugs on their own. But at the same time, when they come in to exchange the needle, they will be offered a chance to go into programs to prevent them from being addicted any further. So it's an opportunity for us in public health or for the medical community to have contact with them, where otherwise we would not be in contact with them, to prevent them from getting infected and putting the rest of the community at risk, and to offer them that help so that they can go into rehabilitation. And these programs, where they are available, have shown to actually get people off of drugs. So it has the effect of helping people understand that they have a problem and to deal with that problem and get off of the drugs.
Thank you. Do we have any questions? Yes, Hassan.
Yes, heroin. If you're addicted to heroin, how you, I mean, the average person that's addicted to heroin, they go to the hospital, they take methadone. And that's just a lighter form of heroin. So how are you getting people off of drugs? What, they straight kicking or what? Are you giving them methadone?
It depends a lot on the person. So there will be medical professionals there who will come into contact with the person and assess them to see what is best for that person. In some cases it may be methadone, in other cases it may be some other kind of therapy, in other cases it might be just be talk therapy, mental health kind of therapy. So it will depend on the individual and what their needs are.
So I think the point is that they're going to try to get people on programs, بإذن تعالى. Any questions on both presentations? Yes. Is the immune system of a 3-month-old baby sufficient to fight the virus if they are infected?
3 months, the baby is still developing his or her immune system. So I'm not aware whether they will be able to withstand an attack of the virus. However, we know for sure that no person died under the age of 10 in this novel coronavirus outbreak. So there
has not been.
There are no mortalities. No one died under the age of 10. And the reason is because when we are young, our immune system is very strong, and it starts going down at puberty. So as Dr. Schwartz mentioned, the elderly and those who have underlying conditions are the ones who suffer the most.
So we have a question in the back. Yes.
I wanted to know, you said naloxone and Narcan, are they the same administered? I just want to know what's another name.
Naloxone or Narcan are the same thing. Naloxone is the name of the drug, and Narcan is a trade name. It's what they sell it as. Yeah.
Okay. Yes, we have another sister with a question. So the question is that Fairfax County means tests, there's programs typically, income tests or other sorts of tests. Is there some sort of a means test if someone is addicted and needs help? Is there some sort of a means test for this program?
No, there will not be anybody who is in need of it will be taken into the program.
Yes. Who is covering the cost of coronavirus testing if they're insured or uninsured in the county?
So if people have medical insurance, they can get a commercial test. from their doctor, sending it to a regular medical laboratory, and then they or their insurance would pay for the test. For people who cannot afford the test can be done by the Virginia Department of Health for no cost. And so, so far, because the only laboratory in Virginia that has had the test is the Virginia Department of Health lab, nobody has paid anything up until now. Now, as more tests become available commercially, it'll either be done through insurance or for free at the health department.
Yes. So the question is, if someone's traveling to an area that has had infection, what sort of measures should they take, like California or Washington State?
So if you're traveling to an area with infections in the United States, do those social distancing measures. Try and stay a little bit apart from other people. Wash your hands frequently. Don't touch your mouth, your nose, or your eyes. If you get sick, obviously stay away from others or stay away from other people who you know are sick. The number of cases, even in California, is still very small. So the chances are that you're going to be absolutely fine, that you won't get infected. But by practicing these good behaviors, you can help keep yourself safe and healthy if you come in contact with someone who does have coronavirus.
Before the next question, I want to have Dr. Usama address something. If by next Friday someone is feeling symptoms, what should they do? What is it that would, in your mind, would prevent someone from coming to a Jum'ah prayer?
If he or she exhibits some of these symptoms, such as fever or cough, in my opinion, they should avoid coming to any Jama'ah prayer.
Thank you. Yes, Abdul Razak. So how do you prevent yourself from getting the virus, and what do you do if you get it?
No, I say this one question.
Yes.
If I get it or somebody get it.
Okay.
Number two is what are the best coronavirus treatments so far?
What are the best coronavirus treatments thus far?
I'll start with the last question, and currently there are no coronavirus treatments. The patients, usually the doctors who treat them just treat the symptoms. So it's up to the person's immune system to help them overcome the infection, plus the supportive treatment that comes, the indirect supportive treatment that the hospitals or the clinics or the doctors provide. Prevention, Dr. Schwartz mentioned so many things, but to be specific, we as Muslims, for example, Saif had mentioned at the beginning, before you start your wudu, wash your hands for 20 seconds with water and soap. That's the current recommendation and the best thing we can do. Also, in my opinion, we should avoid shaking hands, having very powerful hugs. When we make dua, we should avoid wiping our face after we make a dua. You know, we traditionally do this. We should avoid doing it for the time being. And if one is sick, we should not come to the masjid. There are other things that we should be paying attention to. We should be, for example, disinfecting surfaces, that the area where we eat, the area where we write, where we work, where we ride, we should use disinfectants to disinfect those surfaces. We should avoid sneezing in the air or in our hands, you know, always in a bent elbow or in a tissue. Dr. Schwartz talked about the face mask. There is one advantage of someone wearing a face mask, even if they're not sick, and that is it will minimize you touching your nose and mouth. So it's really up to you. You know, some people, they get into the habit of always touching their eyes, their mouth, their nose, but putting a mask may help reduce your hands from touching the mouth and the nose. I've read an article in the New York Times a couple of days ago, and they mentioned 4 things to try to help you avoid touching your face. These are: keep a box of tissue around. Whenever you feel the urge to scratch your nose or touch your mouth, hold a piece of tissue instead of your fingers and do that with it. That's one. The second, identify the triggers that cause you. It's kind of a compulsive behavior. So try to concentrate between you and yourself and see, what do you do? Why do you touch your face? If you are scratching your eyes, maybe your eyes are dry. Maybe you need an eye moisturizer. So try to identify the triggers that trigger you to touch your face. A third suggestion was, keep your hands busy. Like hold a stress ball or hold something that will keep you occupied and make you minimize touching your face. And a psychiatrist talked about this by also saying you need to chill. So if you have washed your hands with water and soap for 20 seconds, don't be obsessed, because it's better for you not to be stressed about this, because stress is going to reduce your immune system. So chill and relax, knowing that you can still touch your face if you had just washed your hands with water and soap for at least 20 seconds. That's the 4 suggestions that I read a couple of days ago.
Do we have any other questions from the sisters? Yes. So is there a certain environment that allows the virus to survive, and is there a certain environment that doesn't allow the virus to survive?
Yes. We always have to remember that the infectious part of this virus is being in close proximity with one another, especially when someone is sick or has the virus. And that's why they say that perhaps when the weather is warm and people get to the outside and no more are sequestered in closed environments, perhaps that will help reduce it by maybe 10 to 20%, but that's not a guarantee. So being in open environments, which will reduce the possibility of getting the infection, that's one. Some scientists say that warmer weather may help, but currently there is no evidence that that is the case. That's what I can think about.
Okay, yes. If you have the virus and you go into quarantine, what is the process of quarantine if you have the virus?
So the process of quarantine means staying home, staying away from others for until you're better. So if you have the virus, if you're sick, it's called isolation, and the recommendation then is to stay in your room, to have your own bathroom, not to share a bathroom with other people in your family, to close the door of the room, have someone bring you your meals, but to stay separate from other people. The process of quarantine means somebody who is exposed but is not yet ill, so someone who has no symptoms of disease but has been exposed to COVID-19. And so for quarantine, what you would want to do is you would want to stay away from other people for a 14-day period, because any time within those 14 days you could become sick. So if you're not sick, if you're exposed to someone with the virus, you want to stay home for that 14-day period. If you are sick, you want to stay separate from other people in your household until all of your symptoms are gone, until your fever is gone and your cough is gone, plus another day, plus another 24 hours.
We had another question back here.
When does a doctor request a test for coronavirus for a patient?
So what triggers a test for coronavirus at the doctor's office for a patient?
If a patient had a history of traveling to a place where the coronavirus is, if they had a history of coming in contact with someone who had coronavirus, and if they have the symptoms of cough and fever, they would then get tested. So it's a combination of both the illness, the cough and the fever, plus the exposure, the travel, the contact with someone else who had it. Or if you are an older person, if you have serious disease, if you have pneumonia, you should also be tested.
Other questions? Should we avoid closed areas with central HVAC systems?
So coronavirus does not spread through the ventilation system. It doesn't remain in the air, it doesn't go through the ducts, it doesn't go with the air conditioning. It only spreads to people who are in close contact, who are within 6 feet of you. So that you don't need to be concerned about a building. If you're in one room and someone who's sick is in another room, that's not going to spread the infection. It really requires direct contact with the secretions from the patient.
So we have a question here, is there a way to self-test?
Unfortunately, there is no way to self-test, and there also are not rapid tests, so that if you are tested, your doctor would need to send that test off to a laboratory, and you would not know the result until the next day.
Is there a connection between immunity and corona?
If you mean by immunity and corona, do you mean that if you have a good immune system, you can, yes. And this is true for all types of viruses, bacteria, cancer. The immune system is the main player in your body that handles anything that's harmful to you. And I've mentioned in my talk some of the things that we can do to enhance and strengthen our immune system.
So inshallah we'll pray in just 5 minutes, bi'idhni ta'ala, with your permission, Sheikh Mahmoud. We have a question from Dr. Suhaib.
This coronavirus, if a patient recovers, can they have a second case of the same coronavirus?
The question is, from an immunology perspective, if a person has corona and recovers, can they get the virus again?
From my information, no, because once you get the coronavirus, you develop a very strong immune response to it in the form of antibodies, and this is like a vaccine. That's an actual vaccine that you took, and it will protect you from, did you hear about?
Have there been any cases otherwise?
Not to my knowledge, I don't know.
Okay, we'll take 2 more questions. Any questions? Yes. How long can the virus survive outside of a host body?
It depends on the temperature, the humidity, and also what surface it's on. So on a hard surface like this or on a metal surface, it can survive for several hours, and it can remain infectious. And that's why the recommendation is to wash your hands, because you're touching surfaces everywhere, every day. And so the virus can then get from the surface onto your hand, and if you wash your hands, it's a way to protect yourself.
What about on soft surfaces?
The soft surfaces, it does not survive for very long. And that's why if you sneeze onto your sleeve, the virus is not going to remain on your sleeve.
So did everybody hear that? If you sneeze on your sleeve, when you're sneezing or coughing, it will not survive on your sleeve. So please sneeze in your elbows. So I think we're gonna wrap it up here. because we're late for Salah. And then what we will do, inshallah, is we're going to get the information that Dr. Schwartz and Dr. Kandil presented, as well as the harm reduction program information, and we are going to put it on our Facebook page, as well as all of our social media pages, inshallah, at Dar Al-Hijrah. Thank you very much. Can we get a round of applause for our presenters today? We appreciate your time. We appreciate the information. Inshallah, as we had been announcing at the beginning of the program, we'll remind everyone again, our goal, inshallah, in the next few weeks is wash before wudu. So when you're making your wudu, wash your hands with soap as you're starting the wudu, so that we can promote a healthy environment for the masjid. If you're feeling any symptoms of any fever, or if you're coughing or sneezing, please don't come to the masjid with those symptoms. Stay home, make your prayers at home, inshallah, and it'll be accepted from you, bi'idhnihi ta'ala. With that, we're going to conclude our program, and we'll have the adhan and the iqamah.